The BRAVE program is a program within Care Connect Plus that came about for schools to make sure that their youth were getting connected with youth behavioral health resources that they so desperately needed. Once a student is identified that they need some help, the referral comes through the system from one point of contact to our BRAVE navigators. What then happens is we reach out to the families, gather information, provide them clarity, kindness, and peace of mind, and talk to them about our role in this process.
It really started with a conversation between us and the St. Johns County School District. They were really struggling to get their students and families who needed behavioral health services connected to those services. And so we started in one county, in St. Johns County, and really worked together to see what we could do to affect change in a couple of different areas.
We have many partners within our network because a lot of what we do is not just mental health, but we know that mental health is tied into everything. So when some families are struggling with a rent insecurity, financial insecurity, a food insecurity, any other social determinant of health within the household is what we will also help with. So it's holistically supporting the family in every area.
My name's Bridget, and I work with Flagler Health Plus. I'm one of the BRAVE navigators, as well as the wellness coordinator over at Webster Elementary and Southwoods Elementary. The thing I like about BRAVE being in the schools is that mental health is not just for people that are going to a facility to be an outpatient or going to a hospital. The thing I love about it is that the providers come to the students. This is working around their schedule and making sure that they can talk to somebody and see somebody, but while being at school. The best part about this program is it doesn't all have to cost money. It's always about insurance. It's about being there for the student, and that's what the BRAVE program is about.
Bridget was truly a lifeline for us. Literally a day after we were referred to the BRAVE program, Bridget gave us a call and just showed so much compassion, so much care, both to us as parents, but also towards our son. She was able to bring the resources that were at her fingertips to bear on this issue. And by the end of the first phone call, had already found us a mental health counselor within our area who could see us almost immediately.
Length of time to services is one of the biggest issues that is dealt with and felt nationwide. There can be wait lists for 3 to 6 to 9 months, depending on whatever service you're looking for. With the BRAVE program, we're really proud of being able to float at around 15 to 20 days of getting someone in the seat in an intake to be able to speak to a counselor.
We have a lot of children that deal with trauma inside their homes. Some of these students, they do have to be the adult at home. We can deal with hunger, we can deal with clothing, we can deal with the lack of school material. But when it comes to the emotional and social needs of these children, we do rely on partners like BRAVE that will help us give direction for those children.
Some of the greatest needs that we've seen in the community, a lot of anxiety, a lot of depression, a lot of family structure stuff where people are doing a lot of things really right, but there's like that systematic stuff of like poverty or transportation being an issue. And so when we're thinking about, I know my kid needs counseling, we need to meet these other needs first. And so BRAVE, with their grant-funded programs, are able to come in and say, we'll take care of the counseling piece. You guys focus on your home life piece. They're able to help us help more kids and then reduce the load on community-based agencies who don't have the same resources that a private practice might have.